works of art, don't you think? Terry and Christy say that's what this life stage is for them, a beautiful, really creative time. Can bioidenticals do that for you? Here's Dr. Tony Breyer with more information.
Bioidentical hormones are plant-based molecules that are identical to human hormones. Women take bioidentical hormones through the skin in either a patch or a spray, sometimes a cream, rather than taking it by mouth. Now, for women that are going through menopause and suffering the symptoms of low estrogen, replacement with bioidentical hormones in the form of estrogen, progesterone, and testosterone can make a huge difference in how they feel. Bioidentical hormones are drugs. They are very potent, and every woman reacts differently to both menopause and to treatments. Your body's chemistry is as unique as your fingerprints. So it's important that you work with a doctor to determine your individual risks and benefits before you start any hormone replacement therapy. Bioidentical hormones have the same risks as other hormone replacement, but they can provide great benefits to women who are having hot flashes, sleep disturbance, low energy, and experiencing low libido from declining estrogen levels. Women's health is a rapidly changing field, and the news media has scared a lot of women away from trying HRT. But a lot of women are benefiting, so find a doctor with an expertise in women's health and determine if you could benefit from it also. I advise women not to be afraid of hormones, but it is important to avoid mail-order pharmacies, and it's essential to have a doctor working with you to customize your treatment.
Have you told your pharmacist everything you're taking?
Anything that's absorbed by the body can interact with other medications.
Tips to getting more out of your pharmacy visit. Change happens. Now you have a personalized health resource that can change right along with you. My Life Stages, created just for women. Online and in your community. Learn more at mylifestages.org.
The next question comes to us through our website. Sarah L. writes, "Help! I've tried so many times to quit smoking, but I'm still struggling with it. Can you tell me how to find something that works?" My first question for you is, are you ready? Here are some tips if you are. Number one, come up with a plan. It is best to make a strategic plan when quitting smoking in order to avoid some challenges you may encounter on the way. Number two, seek support. Talk to family members, friends, or those closest to you about your commitment to quit smoking. These people can help support you and be a source of strength when you need them the most. Number three, talk to your doctor. Ask about treatment recommendations and options that may be suitable for you, and get your doctor on board with your effort. The treatment options include nicotine replacement therapies such as patches or gum, or Wellbutrin or Zyban, and the newest medication, Chantix. Research shows that medications combined with behavioral support can be more effective in quitting smoking than a medication alone. For resources, tools, and support in your area, visit mylifestages.org.
Valuable advice from Dr. Tom, who, by the way, is always telling me how rewarding it is to team up with his patients and form a partnership that really benefits the patient. And that got me thinking about who I could add to my own healthcare team.
Who do you include in your primary healthcare team? Your doctor, your nurse practitioner? Well, how about the pharmacist? You know, the pharmacist isn't there just to count pills and put them into bottles. Many people who view their pharmacist this way miss out on a valuable opportunity to include the pharmacist in their circle of care. What can you do? It all begins with the way you prepare for your next visit to your clinician. Look at your calendar. When's your next appointment? A few weeks before then, grab a pen and paper and write down any medications you find in your home. Check out your medicine cabinet first. What kinds of prescriptions are you taking? Then look a little bit further. What over-the-counter medicines are you taking? Cold or allergy medicines, aspirin or Tylenol? Be sure to write those down. And then consider what other medicines you're taking even topically. What about eye drops or nose sprays, medicated creams or lotions? Anything that's absorbed by the body can interact with other medications. Be sure to write those down. Sometimes we don't think of vitamins and herbal supplements as medications, but these are very important to write down too, as they can also have interactions with medications. As a nurse practitioner here at Sutter Express Care, I can tell you that this is a valuable tool for us. Let's say you're having a skin condition or breathing problem. If we know everything you're taking, we can see if some of those things are the cause of the problem or rule things out. This is a discussion that can carry right over to your visit with your pharmacist. You know when you go to the pharmacy to pick up your prescription and they call you up to the consultation window? That's your golden opportunity to talk to an expert in the field of medication. Give them that list and discuss it with them. They can tell you how to get the most out of your medicine. They can even help you save money on generics if it's in your best interest. The pharmacist can tell you all kinds of information about how best to take your medicine, whether or not you should take it with food, what time of day is the best time to take it. They can help you to know whether or not the medication you're taking interacts with any other medications you're taking. Did you know that the bathroom medicine cabinet may not be the best place to store your medicine? The steam from the shower can actually break down some medications. That's the kind of stuff you can learn right here at the pharmacy. Think of the pharmacist as a specialist. They've gone through lots of schooling so that they could see your healthcare from a unique vantage point. That provides a whole new layer to the healthcare that we as your nurse practitioners and doctors provide.
Great information straight from the experts, and you can get more by checking us out online at mylifestages.org. Thanks for joining us. I have a little more shopping to do, but I'll see you next time.